Ladies and gentlemen, thank you very much for taking the time to be with us today. I am Anne Michaud, Associate Dean of Pedagogy at HEC Paris. And on behalf of the board of HEC Paris, the faculty, and all our teams, I am very happy to welcome you on this webinar today. As an academic institution, we strongly believe that during this extremely challenging period, this unprecedented time, it is one of our raison d'etre to share with you the expertise of our faculty to nourish your thinking with insights from renowned experts in diverse fields. For today, I would like to thank Alberto Alemanno, Jean Monnet Professor of EU Law and Risk Regulation, for being with us. He will offer a learning journey through the global and European response to COVID-19 and sketch the scenarios ahead. Alberto, thank you very much for being with us again, and floor is yours.
Thank you, Anne. Hello, everybody. It's a pleasure to be here. Thank you to HEC Paris for giving me the opportunity to spend some time with you and sharing some insights on what is happening. Let me make a first caveat. This is a target move. So we are just seeing this pandemic unfolding. So these are provisional considerations aimed at improving our understanding of what is actually happening. So let me start by saying something important, which is the following. This talk is not going to be about SARS-CoV-2, is not going to be about COVID, meaning the virus and the pandemic, but is rather going to be about the response that this virus has generated across the world. We're going to take a global look with a specific focus on Europe, because that's where most of you probably are located. But we're going to be looking obviously at China. We're going to be looking at South Korea, at different experiments that are happening in Africa, in North America, in South America, all across the world. As you can see from these slides, this is a global issue that is keeping busy thousands of policymakers, politicians, but also many experts, people who have been devoting their life to different bodies of knowledge, ranging from epidemiology, which is probably the most salient, all the way to statistics, economics, and all possible sciences that are needed to get this right. Most of what I will be saying and sharing with you over the next 30 minutes, followed by the Q&A, it is based on the special issue of the European Journal of Risk Regulation, which has just been published and released this week. It is on free access. Cambridge University Press, the publisher, put all this in free access, so you can easily find this on the Cambridge University Press website by just searching for the European Journal of Risk Regulation, Taming COVID-19 by Regulation. So let me ask you an initial question that I think is very important to contextualize the pandemic in our own individual and collective understanding. How the world responded to COVID-19 as of today. If you are given the chance to score the world response, what score would you give to the response that has occurred so far? So if you could take note of your own mark, that would be very useful. It would give us a sort of idea. Okay. So if you can vote, you click. If you're on YouTube, you're going to take note on a piece of paper, your own note for this. I would like to ask you to do the same in relation to your own country. So how your own country has responded to COVID-19. I think this is an important question also to be asked to distinguish the word from the country. Your own specific country might look doing better than the average response of the world, or actually doing worse. And as you know, there are a few rankings developed by a few political scientists that try to rank countries based on their own response to the virus. Okay, if you have now taken notes of this, I think it's important to briefly remind you where it all started by having a look at the timeline, a timeline that you might have seen across media in the past few weeks. Everything started officially, or at least formally, on December 31st from China, notably from Wuhan, this big city, reporting a cluster of cases of pneumonia. The WHO taking the first initial action on January the 1st, so after a few hours, and then the news spreading across the world, the WHO sending the first signals of the potential threat and the potential pandemic dimension of this threat, and then the initial response by public authorities. The first case detected outside of China is in Thailand on January 13th, so only after a couple of weeks. But we can presume, and by now we have some evidence suggesting that in many other countries, we already had people who acted as vectors for the propagation of the virus. And finally, by the end of January, we have the first official statement by the WHO recognizing this specific virus as a public health emergency of international concern. The word pandemic is not used yet. It's going to take us a few more months till March to have this word embraced by the WHO. So what are the known unknowns? After so many weeks, after so many months, there's still so much we don't know about the virus, and in particular about its transmission, that I think is important to highlight the fact that we don't know. We know not to know about the mechanism of transmissibility. We still don't know how deadly it is. This has to do with many factors, but in particular to the lack of available data, and data which have been collected in different ways, which do not allow comparability. That's why the mortality rate in some countries looks extremely high, even 13, 15%, whereas in others is extremely low. And finally, how many people have been infected? We do not know this due to the limited tested capacity, an issue we're gonna go back to in a few minutes. So these are important questions that in reality, by not receiving an answer, limit our ability to provide the right answers, meaning the right answers, regulatory measures that might render effective our response. So the uncertainty that does not only surround the hazard, but it also surrounds the measures we are taking to counter the disease and its propagation. Let me also contextualize this pandemic. It is not the first, it is not going to be the last, unfortunately, emergency disaster that has struck and caught by surprise politicians, policymakers, but also the citizenry and multinationals. Everybody has been caught by surprise. Nobody was really prepared, even though probably we should have been better prepared, a point I will go back to. When we compare this pandemic to past pandemic diseases that have been keeping us busy, this is possibly the second largest one after the famous Spanish influenza that happened exactly a century ago. Paradoxically, and this is one of the major takeaway of my talk, or perhaps aha moment for some of you, is the fact that the very same response we provided in 1980, 1918 is the response we are using today. We're basically embracing a similar approach. Same instrument for a very similar disease that we don't know as much as we would like. So if we continue the contextualization, let me say that no other crisis has ever led to a paralysis of the world economy to such an extent, not even a war, war in the past. No crisis has led to the home confinement of around 60% of the world population. And no disaster has ever been covered in a 24 hours news cycle, providing sometimes conflicting information, confusing information to the citizens and also to policymakers, and which has been further amplified by us on social media. No crisis has ever raised so many legal, ethical, moral, and political issues, and no crisis has never unveiled in such clear terms the interdependence existing today among our society, but the lack of political governance taming such an economic interdependence. And this match, I think, is very visible these days. There's an incredible, difficult to describe potential for this crisis to reinvent our life, to reinvent the role of humans on our planet and the way in which we interact with one another, and in particular, how our political, cultural, social, democratic systems will be shaped by such a crisis. So we are all a bit lost when facing the magnitude posed by this virus and the consequences which are already felt on the skin of millions, if not billions, of people. When you compare this pandemic to the previous 6 ones recognized by the WHO, I think it's important to highlight how this is also qualitatively different due to a combination of scientific uncertainty about the virus and its transmissibility, but also the effectiveness of the measures we are taking. Does home confinement really lead to optimal result or to suboptimal result? We're going to go back to these questions. When we want to take a picture of the situation today, these are the figures that you see repeated everywhere. We have more and more sources taking track of those based on our limited capacity to capture them. So we're talking about around more than 3 million confirmed cases. We're talking about more than 200,000 global deaths. And this is the average of the death rate and global recoveries. However, if you focus on the month and the projection ahead, if we maintain those measures of home confinement, which have been adopted by the majority of countries in the world, it is pretty clear that the result has been to contain largely, not yet to suppress, because there's still transmissibility going on with major variation across countries. However, it's not easy to define the correlation existing between interventions and the presence of the virus as it is. There's a very interesting research work done by the Blatavnik School at Oxford that measured the stringency and possible correlation or even causality between those measures and the epidemiological situation. The hard questions that inevitably we need to start asking is, could we have saved some lives if we had acted differently? To what extent this pandemic was foreseeable? And we know that many people by now have been predicting the fact that a pandemic with such proportions could have actually happened at some point. And it would have probably been generated in the Asian continent. That's something that has been said and written over time, but obviously there is no possibility to predict the exact feature of such a pandemic and when it actually strikes. So there is predictability, but only up to a point. Why the global alert systems like the WHO were not as efficient as we expected? That's an important question we all ask. And we know there's a big questioning on the rapidity or rather hesitance of the Chinese authorities to inform the WHO and therefore the world about this emergence. We don't have yet evidence on what it occurred exactly. We have a lot of investigative journalism of high quality that has been clearly suggesting that there has been delays, important delays that potentially could have saved lives because they could have contained the virus before it would have propagated across other countries. If the virus is borderless, why the approach overall to containment has been pretty much country by country? To me, this is the most striking story of COVID. The fact that we're talking about one of the most global threats ever faced by humanity, but which has been countered by national solutions. To what extent nation states are better placed than other institutions that may ensure coordination to take those actions. And finally, why countries in this initial period emerge on a pretty common strategy with a few outliers. We know the outliers like Sweden or the United Kingdom initially, or the Netherlands. Why there's been such an emergence? And I would say there's been a lot of emulation by countries that basically said we need to go exactly like what we did in 1918. We should go for generalized, indiscriminate social distancing. We're going to impose the same measure to everybody, regardless of whether they have symptoms, they might be infected, or they might not be infected. But what are the trade-offs? What is going to happen to the world if you confine the whole population or half of the world population, where we're going to see now the major economic, but also social costs that are triggered or entailed by the adoption of such indiscriminate social distancing policies. And finally, what kind of liabilities they might incur our own countries for not acting fast enough or for being late in acting. And finally, I would say why data, the wealth of data, personal data and non-personal data that we generate, that the world is able to collect, has not been mobilized more effectively and more massively in order to avoid, to basically embrace the same recipe we have been using in 1918. I think these are all intriguing questions, and each of it would deserve at least 1 or 2 hours of conversation and deepening, but unfortunately we don't have such a time. So we need to move on by potentially unpacking what it actually occurred. So how did we ended up having the word on confining billions of people? How we ended up into such a solution? Well, when we look at a pandemic of such proportion, there are 2 major approaches which are uncontested in epidemiology, in disaster management, in all across disciplines that look at situations like this one. The first approach is suppression, which basically aim at reducing the number of reproduction. So the average number of secondary cases can be generated by an infected individual. And the objective is to basically make sure that the reproduction number will stay lower than 1. 1 means that you won't be basically infecting beyond. So there won't be transmission further. So you're going to be eliminating human-to-human transmission. Whereas containment, the second approach, is much less ambitious, because at the end of the day, it's all about to reduce the health impact of an epidemic, but not necessarily to eliminate below the reproduction number 1. So to decide whether to go for suppression, the so-called flatten the curve approach, or to containment, the so-called herd approach, has to be contextualized. As I said, we know very little about this virus. We don't know how people are going to respond to our interventions. And we know that society, regardless of the requirements and restrictions, is going to react not only differently, but also autonomously to the virus spread. So we saw countries that allowed schools being open, but kids no longer going to school. We saw countries not home confining people, but people home confining by themselves. So all these factors are variables that make it extremely difficult to make such a choice. But it's pretty clear that there has been almost unanimity in going towards suppression. So this graph by now is pretty clear. There are 2 aims pursued by suppression. We want to reduce the daily number of cases. We want to reduce the reproduction rate, but we also want to do so because our healthcare capacity is limited by nature. And therefore, we want to reach these 2 objectives at the very same time. So once we decide to go for suppression as opposed to containment and mitigation, what kind of approaches are available? We call them non-pharmaceutical approaches. Why? Because they don't rely on vaccine. We don't have a vaccine. They don't rely on pharmaceutical products. We don't really have them, despite some attempts. And therefore, we are going to go for non-pharmaceutical approaches, which basically boil down in social distancing measures, which have different degree. They range from isolating cases which have been already detected all the way to confinement of the whole population. These measures have been mainly mandated to us, so they are strictly enforced on us, at least in most of the countries. But there are also some other interventions which have been simply recommended. The fact of having certain personal protection measures like the mask, which has been only made mandatory in few countries. There's an ongoing questioning on the effectiveness of the mask for the person who wears it and for the person who is exposed to somebody who might not wear it. And then environmental measures like hygiene rules that have also been recommended a lot. So for a list of non-pharmaceutical approaches consisting in social distancing, you can see school closures, workplace closure, canceling of public events, all measures that currently we are considering to actually lift due to the need to ease the restrictions in order to potentially go back to some forms of pre-COVID normality. When you look at the stringency of those measures at the global level, going back to the Oxford COVID-19 Governance Response Tracker, you see that the darker color are the stricter countries, the countries that have been more intrusive on personal life, on organizational activities, whereas the lighter ones are those where the stringency is less developed. So this is the big picture. This is a focus on Europe. You can see that virtually all European countries have adopted a strict measure, home confinement, with a couple of outliers that also include border restrictions, or at least border controls, which are extremely questioned today. As you know, the WHO, confirmed by some studies, suggest that the contribution in terms of propagation of the disease, of these border restrictions, is very modest due to the fact that home confinement is anyway blocking people and stopping people from traveling across borders. There are therefore two phases that I think are very useful for us. There is an emergency phase that is basically at the end. We're at the end of that phase, at least the first emergency, hopefully is going to be only one. We might expect some forms of resurgence characterized by emulation, country by country variation, but then convergence towards social distancing. And there is a phase two, and we are entering such a phase in most countries, which would entail the lifting of measures that would reintroduce a lot of country by country variation. Also within Europe, we can see schools open today and school closed today. We see countries where you can do sport and countries where you cannot go out and do sport. We see economic activities which are still locked and other activities which have been open in other countries. So the big question mark is what kind of coordination, if any, might actually occur within the European Union and among different regions of the world. The case for lifting is increasingly clear. The long-standing effects of restrictive measures are making it more costly than ever to limit the spread of the disease. So the cost-benefit analysis that has been undertaken across the world in order to define whether it was worth taking such a draconian measure is changing. And there is pressure on easing the policy, the national policies. But at the same time, we need to be realistic. We're still very vulnerable to the disease, not only because we don't know it, but also because only few of us actually have been infected and have developed the immunity that would protect them and would protect, therefore, the population. So let's face it, we need to quarantine the infected people to prevent new outbreaks. So the two questions that everybody's asking is, when should we lift and what to lift? Where do we start? Should we start reopening schools, or should we start reopening shops? These are hard questions because we have very limited evidence regarding the effectiveness of those measures in relation to the current epidemiological scenario ahead of us. So the average approach has been, when the number of cases, of new cases, infected cases is decreasing and the healthcare capacity exists, we can lift gradually. And that's what most countries are doing in one way or another. Some are going faster, some countries are a bit more reticent and cautious. But then what do we lift? Well, the idea is to move away from this generalized, indiscriminate social distancing approach. How we can make it? Well, open questions. What about mandating the use of masks in order to facilitate the easing? And here the question is really the evidence, but more importantly, the access to the mask. And we know how many issues there have been in the international trade of masks, since most of masks are produced in Asia, and therefore have to be shipped and travel, and very often object of controversies across countries with a lot of abuses and a lot of limited supply. What about schools? More and more evidence says that this might be the costliest policy, because it would increase exposure of grandparents to kids who are often asymptomatic, but they are vectors for the disease. So you can see there is a risk versus risk trade-off that has to be made. Which industry can safely reopen? Which sector should be prioritized? Obviously, we realize that hospitality, hotel, restaurants today are probably the last that could be taken into account, because by nature are the more inducive to transmissions, whereas factories could be better handled. So this is the direction we are taking. Should we shut borders or quarantine travelers? This is going to be a big question. And inevitably today, each country is making a different maths, is taking into account its own vulnerability. So the bottom line today is that, based on this paper, which has been published on Science and which gathers the common wisdom, I would say, on the current circumstances and the future approach, is that if we can control, we can control the epidemic if we're going to be able to isolate at least 60% of the patients as soon as they have symptoms, so they can be clearly isolated, and then trace back the contacts that those individuals have been having, in order to also limit the ability of those individuals to transmit and propagate the virus. Test, trace, contacts, and isolate infection is a costly business. It's not something we are ready to do as a society. And the big question is how we're going to be doing it. So the first, we require some forms of testing capacity. And the testing capacity is limited. How we can make sure that all people like Bob who are infected are going to be identified. At the moment, only people who are very symptomatic are taking tests because of the limited tests available. So if we embrace this, we need to increase the capacity, which creates obviously a lot of demand vis-a-vis chemical products which are used for preparations of those tests. But this is not enough. Once we know who is Bob, who is the infected, we need to do the contact tracing. So we can do it based on humans activity. We can hire a lot of humans trackers who might actually do this work, interviewing Bob and asking who are the people we've been in contact with, in order to then get in contact with them, let them know. But obviously, since we don't have enough contact tracers, and it's going to be very costly and they're coolly on task, now most of the expectations are going towards apps, meaning technological solutions by leveraging on the mobile phones, which is always with us. But here the question is how we can mandate people to actually disclose and to be available for not only testing, but also to be contacted and then to be potentially disclosed. There are a lot of solutions trying to be privacy preserving, relying on Bluetooth as opposed to geolocalization. And as we know, there is a current discussion on what kind of app or apps should we develop. Today, this is still not enough. Even if we increase testing capacity, so we get Bob, even if we trace back all the people who have been in contact with Bob, we still need high compliance. We need that the people who have been in contact with Bob are going to decide or accept to self-isolate. And this is something that is very much cultural specific, context specific, and which we can rely on too much. In South Korea, 90% of people who were asked to be self-isolated through their mobile phones, they actually did it. Would it be the same in Europe or in other countries around the world? There's an important question mark. And finally, what about monitoring? Should we accept that governments will be exercising some forms of enforcement on the people who have been meeting Bob, but they are not sticking to what we have been asking them? Those are major questions that we need to ask. But now that we are moving towards the post-lockdown future, it is pretty clear that if we don't want to be home confined again, meaning 60% of the port population being home confined, we need to move fast in embracing expanding testing capacity. We need to develop contact tracing methodologies, both human abilities, but also the technology one, and also rely on new social norms. The fact that people respect this distance, people wash their hands, people wear their mask, and overall, we're going to enter into a world that many people define as suppress and lift, meaning that it's going to be very likely that our governments are going to keep adjusting those restrictive measures by opening our freedom of movement and then closing it again. So suppress and lift of measures for the next months, at least up until the moment we're going to be mastering the situation through a combination of a vaccine, for which we will certainly need few more months, even though sometimes we hear some optimistic scenarios, and also pharmaceutical treatments. So this is the possible combination. We need a mix of regulatory measures, medical treatments that together can potentially allow us to free humanity from the uncertainty of this virus, which remains extremely important today. So we need to be extremely humble. At the same time, we also need to learn from what went wrong, or at least from the suboptimal answers that our governments have been giving to such a pandemic. We cannot afford as a society not to learn from what went wrong, because the next disaster, major disaster, which might be bioterrorism or another pandemic or another disease or a climate change manifestation, cannot get us caught by surprise again. So there are a lot of learnings. There's a lot of work to be done from all possible fields, from the individual level to the scientific bodies and corporations. Everybody has a role to play in front of this work. So I'm coming to a close of my brief excursus and unpacking of what happened. But before doing so, let me remind you that if you want to know more, you can download all these papers on open access and the different answers given by different countries, ranging from Taiwan to some European countries, to the UK and other countries in the world. And before concluding and moving to the Q&A, let me quiz you again. Let me ask you again now how the world responded to COVID-19. If you could score this on a scale from 1 to 0, how would you score it? Has something changed? Has your perception and perhaps understanding of the complexities behind both the science and the regulatory trade-offs that were made changed your initial opinion? Are you now more severe? Are you more demanding? Or you're rather more generous vis-a-vis policymakers and experts who, again, were caught by surprise by something which was only half predictable, but not entirely?
Alberto, I suggest that maybe we broadcast the result of the first polling, and then we will move on to the second one. So for world, it was these results that came up.
Okay, very interesting results. So most of you have been grading the world response at a 7 out of 10. So more than a sufficient response. Overall, the world response has been more than satisfactory. Let me put it that way. With very few people who have been suggesting that actually the world response has been better, and many more people who actually have been scoring the world response to 6, 5, 4, and even 3.
Shall I relaunch it now?
Yes, please.
That change. Okay.
If you can now vote, that would be fantastic. Let's see if the score will change.
Shall I put an end to that because the numbers are not moving anymore? All right.
That's it.
And let me broadcast those.
Oh, that's interesting. So most of you now believe that the actual score of the war response has been 5. So we went down from 7 to 5. With some people who remain on 6, they remain on 7, but you went down in average. So probably the message I've been conveying to you is that we could have done it better. And quite frankly, this is my personal opinion. So I might have skewed the result or biased your result by sharing some pieces of information over others. I've been trying to do the best in order to be objective and independent. But I must say, I've been spending a lot of weeks doing research on this. So I've been reading a lot of documents, a lot of alerts, and I have my big major question mark on the current world response.
Okay, thank you, Alberto. I suggest we keep the minutes that we have left to take the questions. So there are quite some questions. I will try to organize them a little bit to organize the end of the discussion. First of all, I think a lot of people being connected are also questioning very much the social response as well to this crisis. And basically, there are some questions related to this. So Alex, thank you very much for asking your question. Alex says, do you think that the 100 billion lined up by the European Commission in support of the national funding for short-time working will be effective in the long term, or a short-term band-aid? And can they be analyzed as the new foundations of a social Europe? So,
okay.
Yeah.
Okay. Well, thank you for your question that transition us to the economic crisis. So this is not only a sanitary crisis, which is unfolding as we speak, but it is already an economic financial crisis, almost unprecedented. The great lockdown has been defined by the IMF in his own prediction, in his own analysis. And therefore, inevitably, since we are already in a recession, our governments and international organizations have already been planning some possible injections of financial support at different level. So each country is doing its own bit, but countries are no longer entirely sovereign when it comes to their own supports, certainly not at the European level, where we are trying to leverage on several potential elements, including the European budget, in order to provide support to our economy. So this, I think, is the important contextualization we are going to be making. The amount of resources available in order to allow society to potentially bounce back is extremely high. But there is a world consensus on the need to mobilize those resources by basically creating more debt. Very few economists are questioning such an assumption. And by creating more debt, obviously we are going to imperil our own future long-term, but at the same time, we are going to be providing immediate solution that would actually improve our well-being in the long term. So it's a difficult trade-off. In particular, in the European Union, you seem to be interested in understanding what has been happening at the European level. As of today, we only have a package of different measures that together would probably make more than $1 trillion. But we know that that trillion is not necessarily transfer given to our countries, but is mainly loans. So we are increasing the debt that those countries will have to somehow bear, and this creates important political implication. The process is still ongoing, meaning that the rescue package, which is the most promising component of the European recovery response, still has to be defined. We don't know about the volume, we don't know about the funding, we know very little because it hasn't been decided yet. In terms of process, it's not going to be the head of state and government to package it, but it's going to be the European Commission with a say of the European Parliament, which is promising from a democratic perspective. But let me say, and then I'm going to close on this, that the nature of this financial crisis linked to the sanitary crisis is very different from previous crises because it's symmetric in nature. It is not affecting or is not affecting one country more than another's, but the ability of each country to actually react in terms of providing financial resources and financial solutions, it is not equal. And that's where the point of contention is, because there is a case for solidarity, for potential mutualization, but there is also a source of political contestation on why we should actually do it. So these are the terms of debate. My personal viewpoint is that we should seize this opportunity to expand the fiscal capacity of the European Union in order to allow the Union to face challenges of such a scale, because this won't be the last one, and there will be more, and we need to be ready.
Mm-hmm. Thank you, Alberto. I think there are many questions, by the way. A lot of them relate to the ecological impact as well, but I will just continue before with some questions about data protection and regulations, and then maybe we'll jump to another topic. But basically, there is Joe Verheyden asking whether, given data protection regulations, could Europe adopt a similar containment approach to China, where people need to share their testing data and tracing goes down to the individual based on mobile geography data without consent? So typically, all these questions about data are really a hot topic in Europe. What is your take on this?
Well, the brief answer is no, not to the same extent and not in the same way, simply because our liberal democracies work in a different way than a country like China. So the solution has to be different. Having said so, that does not mean that we should prevent ourselves from trying hard to develop technological developments, notably apps, that might help us in doing the isolation and in particular the contact tracing that I described. Will it take more time? Will it be slower and perhaps less effective? Certainly, but possibly the trade-off will be important. You know very well, because you asked me this question, that the concern is that all this effort at gathering information about people won't be limited to contact tracing, but it will be subject to other usage, including commercial usages. And unfortunately, we shouldn't be naive, because we know how many abuses there have been about data collection, not by public authorities as such, but mainly by private actors. But the concern is there. And therefore, it is inevitable that we are embracing such a conversation. However, final caveat, I think we should try to be less ideological about this. I don't think privacy is an absolute value. There's no absolute value besides dignity. And this should be compensated or should be traded for other values. And therefore, there might be circumstances in which we can compress data protection or privacy in order to reach a goal, which is basically collective public health protection while preserving up to a certain extent. It's very easy to conceptualize this in theoretical terms. It's much more difficult to translating it. But there are very interesting solutions, as I was saying, relying on Bluetooth as opposed to geolocalization, that today suggest that it is actually possible to do it. And these forms of health, digital epidemiology are not new. We have been working on this for many years. So I think we should seize this opportunity to do it. But again, it will take more time than in other experiences where these occur very fast, but potentially at a very high cost for personal freedom and for democratic erosion.
Mm-hmm. Very interesting to see that actually different cultures might lead to different response to this virus. And actually related to this, there is also Elena that asked a question that has been very much voted on. She asked, what do you think of the actions taken by Sweden? So you answered already about these different actions by different countries, but She mentions how the authorities decided not to take massive quarantine measures as schools continued and most places stayed open. But basically, what do you think about those actions taken by such countries and their difference with others?
Well, the jury is still out. We are not at the end of the COVID pandemic, so it is too early to judge. But it is legitimate for policymakers, after having listened to scientific experts, to take a stance that might seem justified. However, it is true that when a similar approach has been accepted and promoted by the United Kingdom, the UK had to retract and to step back and to basically leave aside the idea of mitigation and to embrace the idea of suppression. And that switch and that retard in switching has costed lives. But again, it's too early to say. We don't know in the long term which would be the best approach, in particular now that the salience of the economic and social cost is there. So we see how much it costed to have this generalized, undiscriminated home confinement and social distancing for everyone. So the current conversation in Sweden is very tough. It's tough because many people felt the government hasn't taken the right decision, but the other half, I would say, of the population is extremely happy not to have paid such a high price. Let me add a further complexity that I think is so important at the European level, which highlight the distributive cost of different policies at the European level. Why the Spaniards should contribute more to protecting public health in Europe than the Swedes in the short term. Why certain individuals are subject to stricter rules than others, when in the reality we live in a common destiny in which our free movement is basically making us one big country as opposed to 27. So there are major discrepancies. And again, I want to be cautious on this. We are not at the end of the story, question mark. I think it's fascinating for a researcher, a bit less for citizens, to see these laboratories of democracy testing new solutions and comparing their responses by obviously taking into account, as you said, Anne, and as you reminded, major cultural responses. So the fact that the Swedes behave in a particular way, do not kiss one another, do not shake many hands, certainly has been a contributed factor in containing, up to a point, this particular spread of the disease.
Yeah, thank you. So thank you very much. As I said, well, there are more questions about geographical differences, but I just wanted to address a couple of questions maybe that have been asked and very much voted on about the ecologic transition. And so there are two questions that are at the top of votes. One from Patrick, who says, do you think that ecologic transition will be postponed because of the crisis? And then Pascal is also asking, do you think the COVID episode will question the way we treat our ecosystem, or will be an opportunity to justify a move backwards? So I'm sorry, Alberto, I give you two questions at once, but I think the two of them are very much related. Is it going to be postponing this ecologic transition, or maybe to an opportunity to justify to move backwards? What's your take on this?
Well, this is the $6 million question. It's the most difficult question I could have been asked. And at the moment, analyst observers are split between the optimistic and the pessimistic. I don't take a specific stance. I try to unpack the terms of the debate. I think it is pretty clear that this has been yet another wake-up call, potentially the most significant in terms of magnitude and felt on citizens' skin about the fact that we need to reconcile with nature. There are more and more studies looking at the genesis, at the propagation of this virus that suggest that this is not so much something that came out of nothing, but is pretty much the result of the extraction behavior that humans had vis-a-vis planet for too long, issues like wildlife trade, issues like exploitation of fields for centuries, high use of pesticides. Certainly the attack that humanity had vis-a-vis biodiversity is one of the confounding factors behind it. So This is pretty big. This accelerate the awareness raising that already occur thanks to Greta's Fridays for the Future movement and all the citizens mobilization, and certainly operates as a wake-up call. This also has deepening social norming changes because each of us has been experiencing a very different way of living. I haven't taken a flight like most of you, a plane for 2 months, and I managed to work. I managed to teach. I managed to be more perhaps with my family and to be more efficient with my life. And this applies to organizations, applies to multinationals, applies to governments. So all this social norming formation is set to stick. So it's not going to disappear. We're not going to forget about this because many solutions, in particular the most innovative, are extremely effective. So this is the positive side, saying, well, this is irreversible. Policymakers cannot but continue and even accelerating the ecological transitions they were chatting about, and now it has to happen. But then there is the other side of the story, which is who's going to pay for it? Especially now the companies cannot really afford it. And I think the solution there, and the role, the prominent role, and the real answer to be given to your question will be the engagement and creativity of governments to come up with solutions which are sustainable, viable, and will incentivize corporations to adapt to the new expectations and needs of the planet. So all the talks about making conditional the recipient of the transfer of resources from governments to companies to their adaptation to a fair taxation system. So if you have all your headquarters and your tax planning system in the Netherlands or in another form of tax haven, well, this might be problematic because you're not going to be benefiting it. So this might be disruptive. We might see big multinational shifting their capitals from one country to another in order to get access to those funding. But the question is how serious and committed our policymakers will be. And we already have a lot of evidence, sorry to be gloomy, but a lot of evidence that corporate lobbyists have been using this opportunity to slow down the entry into force of regulations which were already adopted, which were very demanding, very restrictive, but in an incremental way. So as you can see, this is the ecosystem, the public policy ecosystem in which we are. And I think the combination of government political will and the attitude of an avant-garde of progressive companies will make a difference. Unless the avant-gardes are going to support the governments, unless the governments are going to support the avant-gardes, we're not going to see this breakthrough. And it would be a really one-in-a-generation opportunity to miss.
Okay, thank you very much, Alberto, for these answers and all this enthusiasm on the topics. There are many more questions, so I'm sorry we will not be able to address them all. There were questions about behaviors, but actually you addressed that point as well, whether we will change our behaviors in the coming weeks, months, and maybe forever. Based on what we have experienced lately. What I suggest is that we close this webinar due to time. Thank you very much, Alberto, for all these answers. Thank you very much, all of you, for being connected to the HEC webinars. As you know, those days, we are very happy to meet with you online every week to again showcase what we do at HEC, well, very happy to see you for the next webinar. Thank you again.